Hi, I am quickly just going to go over the Clinical Research, Resources, and Facilities Core of DaCCoTA, also known as the CRRFC, and what services we have that can be utilized by potential applicants and DaCCoTA awardees. The core includes the core directors, Laura Black from Sanford Research and Dr. Kimberly Hammer from the VA in Fargo, as well as the project managers and core coordinators, who include myself, Miranda Ryder, Tabitha Lemke, and Cassie Gary. We are all from Sanford Research and located out of Sioux Falls, South Dakota. Some of the primary Sanford locations and resources that can be utilized from our core include the Sioux Falls, South Dakota, and Fargo, North Dakota region. We do have other regions, but these are the primary ones that would be utilized to assist with any projects. Resources include the VA and Sanford Biobank, which can be utilized to retrieve any archival specimen or retrospective specimens. This can include blood, serum, plasma, or any tumor tissue that might be needed for a research project. There is also the Honest Broker Research IT, who can assist with getting any large or small de-identified data sets that might be needed for a research project. Pathology services. This can be utilized if we do need more or additional archival tumor specimens, and then any professional consultations. As well as histology, which can be utilized for specific specimen staining or cutting for slides that might be needed for a research project. A brief overview of the services that can be provided include clinician-non-clinician collaboration connections. So if a potential applicant is needing assistance of finding a clinician or a non-clinician to work with them on their research project, our core can help make those connections and secure a collaborator. We assist with human subjects projects design, if that includes figuring out how to recruit participants or patients that might be needed for research, figuring out how we would get some specific specimen collected for a study, or figuring out the workflows specific to a study and how we are going to operate that study. We assist with identifying if there is specimen or clinical data available within the DaCCoTAs, a specific disease site, and figuring out if those are feasible to get. We assist with human subjects research and clinical trial support, whether that be project management support or regulatory support that's needed for the type of study being worked on, or if there's assistance with clinicaltrials.gov for a clinical trial study. We have a resource guide. This provides a list of the research equipment that is available at the partnering DaCCoTA institutions that can be accessed by DaCCoTA awardees, and whether it is available for self-service or not. We also have education on clinical research and human subjects research, knowing what's required and not required, depending on if it involves human subjects or if it is a clinical research trial actively enrolling patients. A little bit more specific into the project management support that we offer. This does include that clinician-non-clinician collaboration connection. So if you are needing to find a collaborator for your project, we can assist making those connections and figuring out who can work with you. We assist with any institutional review board or IRB documents that might be needed, including protocols, informed consent, or assents, and if there's any additional documents that may be needed, as well as those IRB applications. We can assist with developing those, reviewing those in any way that might be necessary. We also assist with the human subjects paperwork that is needed for the NIH application when projects are ready to move forward. We can either draft those documents, assist with figuring out which paperwork is needed, or just reviewing those, whatever level of support is needed there. We assist with any legal documents. If a project is going to collaborate with differing institutions, a legal document might be needed to be put in place, whether that includes material transfer agreements, data use agreements, or research collaboration agreements. We are happy to review any of those, to assist drafting any of those, or even just figuring out which ones, if needed, depending on what institutions are working together. We also assist with any study support documents, including operational manuals, workflows, or any forms or guidelines that are needed for data entry. And this just depends on the type of study, but we are more than welcome to review, assist, figuring out those workflows, or drafting any of those documents. Our core also assists with regulatory support. This can include the Good Clinical Practices, GCP, or biomedical training, also known as city training courses. We assist with drafting any curriculum vitae, biosketches, or just maintaining any medical licenses that might be needed depending on the type of study. If the project involves multiple institutions, we can assist with getting institutional authorization agreements. This is a document between IRBs if one IRB is going to rely on another IRB for oversight of a project. We can assist with identifying if one of those is needed and helping get those in place. We assist with regulatory documents that might be needed depending on the type of project. These can include delegation logs of authorities, protocol trainings, or regulatory binders. We will assist with identifying or maintaining IRB submissions, so there will be that initial IRB approval. If there are any modifications or continuing reviews that are needed during the duration of that project, our core can assist with identifying if those are needed and making sure those are completed. We also assist with clinical research requirements and regulations depending on what type of study or project is occurring and what requirements and regulations are required for that type of project, as well as any specific site requirements depending on the institution or the state that the project is occurring in. And then just some contact information for our core. There's Dr. Hammer from the VA, Laura Black from Sanford Research, as well as the core coordinators, myself, Miranda Ryder, Tabitha Lemke, and Cassie Gary's contact information. If you have any additional questions about services that can be assisted through my core, or would just like to get to know a little bit more about the core and how we can help with your project, please feel free to reach out to myself, Miranda Ryder. My contact information is here, and I'd be happy. Thanks.